Hello guys, in this video we are going to talk about a very important topic, that is the chronic suppurative otitis media or chronic otitis media. It is also called as CSOM. The CSOM is nothing but it is a long-standing infection of the middle ear cleft with the characteristics of ear discharge and a permanent perforation. There are two types of chronic suppurative otitis media depending on the perforation present in them. Perforation of the tympanic membrane. It may be a tubo-tympanic disease, that is a disease involving the medial cleft, tympanic membrane and the eustachian tube. This is also known as safe CSOM. And then another type is the attico-antral disease or unsafe CSOM, which involves the attic part and the antrum of the mastoid. Okay guys, depending on the perforation we can classify. There are two types of membrane in the pars tensa, in the tympanic membrane, the pars tensa and the pars placida. If the perforation involves only the pars tensa, it is central. If there is any involvement of the pars placida or fibrous annulus, it comes into the marginal perforation guys. This is the marginal perforation where pars placida and fibrous annulus involved. It causes attico-antral disease, whereas this central perforation only pars tensa, it is unsafe for tubo-tympanic disease. It does not involve any of the fibrous annulus. Okay, first we are going to see about the tubo-tympanic disease or safe CSOM. And this the infections started from the eustachian tube, either from the nasopharynx or nose. Okay guys, in this there will be central perforation will be present, so there will be a hearing loss of about 10 to 40 decibels per percent. And the type of hearing loss is conductive hearing loss. It is conducting defect. There will be ear discharge due to the infection, long-standing infection. Okay, then there will be this discharge is mucoid or mucopurulent. It may be profuse. It is a non-foul smelling and foul smelling, whereas in the unsafe type it will be definitely foul smelling. Okay guys, this characteristic will be changing here. It is continuous or intermittent. Okay guys, it is also known as a mucosal disease. Okay guys, because of the mucoid protection. It is divided into two types, active or inactive. The active may be, we can say, with ear discharge it may be present, it's known as active. If it's absent, it is known as inactive stage. Depending on the complications, it is active, and there are no complication comes under inactive. The central perforations can are circular or kidney shaped. Okay, whereas the traumatic perforation due to slapping, it causes a unshaped or irregular perforation. But here there are well defined margins. Different types of central perforation include, if there is involvement of only one quadrant, as you see in here, very small, this is known as small central perforation. If it involves two quadrants, it is known as medium perforation. If it involves three quadrants, very large, then it's known as large. Then if involves all the four quadrants but does not involve any of the fibrous annulus, it is known as subtotal perforation guys. Whereas the marginal perforation, when this subtotal comes along with the if any of the fibrous annulus spot, it comes under total perforation. So this total perforation comes under the marginal perforation guys. Okay, it involves all the four quadrants plus the fibrous annulus, it is the total perforation. Then the treatment for the active, that is profuse discharge is there, so you should give the antibiotics and reduce the discharge. And when it comes to the inactive stage, or the no production of the pus or mid pus discharge, you can go for a tympanoplasty. Depending on the type of ossicle is affected or not, there will be meringoplasty plus repair of ossicles. Okay guys, or you can go with the myringoplasty, only repair of tympanic membrane. The difference between a traumatic perforation and disease perforation is, the traumatic perforation will, as I said earlier, this irregular or rough margin will be present there. There will be blood clots around perforation. This most commonly occurs due to slap when the palm meets with the pinna. Okay guys, but this 90% heal on its own in about 3 to 6 weeks. If it does not heal, it is a grievous injury. The person can go to court and appeal under 320 IPC. Then the disease perforation will have a circular kidney shaped margin, clear margin will be there. um, Multiple perforation will be seen in certain conditions like TB. There will be severe class will be there. You can see the multiple perforations here. There will be, it's painless and it's a chronic infection. It is foul smelling. It is there. It is pale glandular